Dementia is the general term for a social event of diseases or conditions that make a shortcoming a singular's thinking, memories, or heading. Recs collected under the general term dementia are achieved by bizarre frontal cortex changes. These movements trigger a diminishing in figuring skills, generally called intellectual abilities, adequately outrageous to block everyday presence and free capacity. They also impact lead, feelings, and associations. Anyway, dementia generally impacts more prepared adults. It's everything except a piece of standard developing. Numerous people live into their 90s and past without any signs of dementia. According to World Prosperity Relationship, about more than 55 million people live with dementia all over the planet, and there are very nearly 10 million new cases reliably. It is furthermore the seventh driving justification behind death among all infections and one of the critical purposes behind impairment and dependence among additional laid-out people all over the planet. There are a couple of unmistakable kinds of dementia, including Alzheimer's disease. A singular's after effects can move dependent upon the sort. The signs and secondary effects associated with dementia can be sorted out in 3 stages. The starting period of dementia is every now and again dismissed, considering the way that the start is ceaseless. Neglect, forgetting about the time, and getting derailed in recognizable places are typical side effects. As dementia advances to the middle stage, the signs and after effects become all the more clear and may include becoming diverted of continuous events and people's names turning out to be frustrated while at home, experiencing growing difficulty with correspondence, requiring help with individual thought, experiencing conduct changes, including wandering and kept examining. The late period of dementia is one of near amount to dependence and inactivity. As previously stated, there are numerous types of dementia. Memory problems are serious, and the actual signs and side effects become more obvious and may include becoming uninformed about the overall setting, having trouble perceiving family members and friends, having difficulty walking, and experiencing behavior changes that may raise and include hostility. These include Alzheimer's contamination, AIWA. This is the most notable justification behind dementia, addressing 60 to 80% of cases. It is achieved by changes in the frontal cortex, including strange advancements of proteins known as amyloid plaques and tau tangles. The brand name side effect is difficulty recalling recent events, such as a conversation that occurred minutes or hours earlier. Vascular dementia conditions that interfere with the flow of blood and oxygen to the brain cause this type of dementia. After effects change dependent upon the area and size of the frontal cortex impacted. Lewy body dementia. It is a kind of dementia achieved by bizarre stores of the protein alpha-synuclein called Lewy bodies. In this, people could have improvement or harmony issues like robustness or shaking. Numerous people similarly experience changes in availability, including daytime dormancy. Additionally, they might experience visual mind flights. Frontotransient dementia. Strange amounts or types of the proteins tau and TDP43 are connected to it. This sort of dementia most often prompts changes in character and lead because of the piece of the frontal cortex it impacts. There may moreover be issues with language capacities like talking or understanding. Mixed dementia. Sometimes, especially in older people over the age of 80, multiple types of dementia can affect the brain at the same time. A person might have both vascular dementia and the Alzheimer's disease. Dementia is achieved by mischief to neural connections. This damage blocks the limit of neurotransmitters to talk with each other. The frontal cortex has various specific regions, all of which is liable for different capacities. When cells in a certain area are damaged, that area is unable to perform its functions, frequently resulting in dementia symptoms. There is no one test to conclude whether someone has dementia. Experts examine Alzheimer's and various kinds of dementia considering a careful clinical history, a genuine evaluation, lab tests, and the brand name changes in thinking, ordinary capacity and lead. There is currently no dementia treatment available. Against dementia drugs and disorder-changing medicines made to date have limited practicality and are primarily named for Alzheimer's contamination.